In patients with shoulder pain, one of the most common mistakes is to assume that muscle function is correct, just because mobility is good. But when there is a supraspinatus tendinopathy, it is common to find an altered muscle activation pattern, even in the early stages. And if you don't detect it in time, the effects can be very harmful. By the way, you can contact us through the link in the description and find out how to integrate electromyography into your daily practice to identify which muscles are failing and which are not. In this post, you're going to learn 2 movements that you absolutely should use to identify a weak supraspinatus in patients with rotator cuff tendinopathy. Not properly assessing the function of this muscle can lead to a higher risk of the tendinopathy becoming chronic. Muscular compensations that cause overload in the deltoid, upper trapezius, or infraspinatus, a slower and less effective recovery. Functional loss in basic daily or sports activities. And the key is to objectively identify that weakness so you can act before these compensations become established. What are the most common functional limitations? In a supraspinatus tendinopathy, deficits usually appear especially in shoulder abduction and flexion movements, in external rotation movements, and in combinations of both. For example, exercises or functional movements with the arm elevated and externally rotated. This means that many conventional exercises are not entirely effective if you don't really know whether the supraspinatus is being activated as it should be. So how can you assess the supraspinatus with electromyography? Electromyography will help you see whether the supraspinatus is fulfilling its function or if other muscles are taking over its role. Here are 2 simple but very effective diagnostic tests to identify its weakness. The first test will be a shoulder abduction. The neuromuscular goal is to find symmetrical activation between the supraspinatus on the affected side and the healthy side. In other words, the left supraspinatus should activate the same as the right supraspinatus. What is the common result in a tendinopathy? Take a look at the results. The left supraspinatus, the healthy one, activates much more than the right supraspinatus on the affected side. This indicates an activation deficit on the painful side, even if the movement is performed with a full range of motion. What does electromyography provide? It helps you detect this difference objectively, even if the range of motion seems adequate at first glance. The second test is an external rotation with abduction. This test requires more coordination and control. It's ideal for seeing if the supraspinatus can activate properly during a more functional movement. The neuromuscular goal again is to achieve symmetrical activation between both sides. But what is the usual result in tendinopathy? Take a look at the image. Again, the left supraspinatus, the healthy one, activates much more than the right supraspinatus on the affected side. The affected side shows a much lower activation peak or a delayed activation compared to the healthy side. This pattern confirms that there is poor integration of the supraspinatus in more complex synergies. Therefore, supraspinatus weakness is not always obvious at first glance, but if it is not detected and corrected, it limits recovery and increases the risk of relapses and chronicity. With electromyography, you will be able to detect functional deficits that are invisible in conventional examinations. You will be able to choose the most appropriate exercises for the patient's specific stage. You will avoid compensations that hinder improvement. See you in the next post.